This segment sponsored by Femme Medical Spa. Welcome back to another edition of Women's Health Wednesday with Dr. Ashley Scott with Femme Medical Spa. Hey there, doctor.
Hello.
Okay, so today we're talking about menopause and why it's so hard to lose weight, so listen up. What is it about that age range that women find it so hard to lose stubborn weight?
Okay, so there's a lot that is happening in menopause. I think a lot of women just think of this as a hormonal shift, but I am always educating my patients that it's a metabolic shift first. And so metabolically what's happening is that as we lose estrogen, it causes, a chain of events that's happening with the metabolism. It's slowing that metabolism down, and so weight gain becomes a lot easier and weight loss becomes more challenging. And so a lot of women will say, you know what, I'm eating right, I'm exercising, I'm doing all the things that I used to do, but I can't lose the weight. And I remind them, well, there are physiological factors that are now out of your control. You have to now fight that physiology if you want to lose.
Ooh, okay, so let's talk about when it starts. Is this during perimenopause? Oh, it starts there.
Oh, it starts there, absolutely. And so, it's not going to be overnight. It's a very subtle, gradual change. And I think another thing is a lot of women think that, okay, this is going to start happening in my 50s.
Yeah.
No. Even like in the mid-30s, this will start to happen. And so I am even having this conversation with my patients. They're coming in just for an annual exam. They have no idea that we're going to go down this path. But I'm going to take them there because I want them to be prepared to understand that we don't want to be reactive. We want to be proactive in this transition.
Okay, so it's more than just like eating right, exercising, and doing those things early.
Absolutely.
What you're saying is that literally you have to make medical changes. And so is it medicine-wise or is it just overall lifestyle changes that's deeper than people understand?
Well, both.
Okay.
I would say I am a strong advocate for making sure people are eating their protein.
Okay.
Because another thing that's happening as women are going through this menopausal transition, as we lose estrogen, our fat distribution changes. So the fat is no longer superficial, it's no longer, in the places that we want it, in our thighs and our butt. Now it goes to the abdomen, and that fat is a lot more inflammatory. So it increases your risk for diabetes, cardiovascular disease. But then the other thing that we know is as we get older, we're losing muscle. And muscle helps to drive the metabolism. So eating protein is helpful, but then also strength training exercise. We counsel that 150 minutes of exercise a week is ideal. And we want to split that between cardio and strength training. So it's not just, well, I do this, but I don't do that. Both of those things become important because also your bone health is impacted. And so, menopause is going to have an impact on almost every cell in our body. And so we can't think of things in isolation. We have to think of it as a whole system.
Oh, I love that. Oh, and you said it so perfectly. It just makes sense because the muscle mass that we lose is what makes, as you age, you become more brittle, right? And more fragile because you're losing that. But there's a way to keep it up early by doing the strength training.
Yes, you do the strength training. You should always eat healthy and exercise. But then there are some women who they're doing that and then they're still frustrated. And for those women, I am very understandable because, I want to make sure that you are still happy with who you are. You're happy with what you are looking at in the mirror. And so when you are optimizing, the lifestyle changes, but you still need some help, then we have medications that can help with that transition as well.
Okay, yes, and these are medications that people are used to hearing about as of late, which is
GLP-1s.
Let you say
and so, they're costly, which is frustrating, but, we understand, that metabolism change that's happening. And so for me, I'm like, well, we are going to do a full lab panel. I want to see what your cholesterol and your full lipid panel is like. I want to see how your liver is functioning. Because if we can find any abnormalities that can show that there is an increased health risk, then we can help to get it covered. So it's no longer just, well, do you have diabetes or do you not have diabetes? You can have this medication. We can figure out a way to get it covered. And if we can't, then there are oral medications that you can have as well. But I will say the beauty of a GLP-1 in particular for menopausal women is, as I was mentioning, that fat that goes deeper around those visceral organs. Well, GLP-1s can help with a process called lipolysis. So that is the breakdown of fat. And so it's not just about, decreasing that food noise and helping you to feel full longer. You get that extra added benefit from that medication. And when someone is in menopause, if they're on hormone replacement, as well as taking a GLP-1, then that combination of medication they enhance each other's impact. So it just helps with the weight loss if you're on estrogen supplement.
Yeah, and I think that's important that we talk about tackling the misconceptions of the medicine that's been popular, because people are like, okay, Ozempic, Wegovy, Mounjaro, and all this, and it's like, okay, that's just for people who are rich, that can't afford it. They just want to lose a little weight. But it's so much deeper than that.
Oh,
I
absolutely.
see the studies that come out that has overall health benefits in bigger ways that people even realize it.
Absolutely. And then, we also know that a GLP-1 can help with your cardiac function or help it's cardioprotective. So there's a lot more benefits to it than I think there are risks. You still want to make sure you're having a discussion with your provider to make sure you're an optimal candidate for it. But at the same time, with my menopausal patients, I don't necessarily push a number on the scale. I know that that's important for them, but more so for me, it is making sure metabolically you're healthier, and that's what will help to prolong your life. Now, if we can get both what we want, you get your weight loss and I make sure you're healthier, then it's a win-win all around.
I love that. So you offer this at your practice. You offer weight loss management, menopause treatment, like hormone therapy, and all of that stuff. So they just have to come and say, Dr. Ashley, I am having hot heat sweats. I am all the things, and I can't lose this stubborn weight. Help me out, and you'll do the workup.
Yes, and I love to educate myself in all of these different facets. So I did make sure that I am certified in all of these things, so you can really trust the advice that we're giving.
Yeah. Well, good advice today.
Thank you.
And if you would like more information about Dr. Ashley Scott and her practice, Femme Medical and Spa, we'll have their website listed below. Make your appointment, and I'll see you after the break. This segment sponsored by Femme Medical and Spa.